brings us to Dr. Ashish Jha, who's director of the Harvard Global Health Institute. Doctor, good morning to you. I'm sure you heard the HHS Secretary Alex Azar's warning that, quote, the window is closing for us to take action and get this under control. Do you agree? And what needs to be done right now?
Yes, so good morning, and thank you for having me on. I do agree with Secretary Azar. The window here is very narrow. This is something we've known about the virus, that if you fall behind, as we have, then you've got to act quickly and aggressively. I think across all these states, we just can't have bars. I'm not sure that we can even run restaurants where people are seating indoors, nightclubs, anything that gathers people indoors, I think at this moment is way too risky and has to be dialed back.
And what do you attribute this rise to? Some people talk about the Memorial Day crowds. Some people wonder if the protests will lead to more virus cases spiking, the lack of wearing masks uniformly. What do you think is behind it?
So I think it's a combination of all of the things. If we think about the things that are really risky, most of these states opened when their underlying level of cases was really still high. They weren't coming down. So I think they didn't meet the White House's own guidelines for opening up. And then gatherings, especially indoor gatherings, bars, restaurants, those are particularly risky. And then almost none of these states had mandatory mask laws. So put all of that together, and I do think that that's a combination of factors that has led us to where we are today.
And now we're closing in on another big holiday, 4th of July. What would your message be to people who are considering a gathering, even a gathering outside, or expanding their circles right now?
Yes, if you're in one of these hot zones, then really I think people have to rethink any large gathering, whether indoors or outdoors. But of course, indoor gatherings I think right now are very risky. So outdoors are better. If you want to have a backyard barbecue and can keep socially distanced from your neighbors, I think that's probably okay. But I think people should be wearing a mask, and we've got to really try our best to reduce the level of risk because our hospitals are getting pretty stretched across many parts of the country.
We also saw those images, Dr. Jha, long lines, people waiting for testing in some of these hotspot states. And by the way, very close together, waiting for testing. What do you make of that?
Well, it's so frustrating. You know, many of us have been talking about testing for months. People have actually gotten bored of the fact that all these public health people keep talking about testing. And yet here we are. We still haven't figured out testing. People should not have to wait hours to get a simple medical test that we as a country know that we've needed for many, many months. So when we hear from our leaders that we have too many tests or plenty of tests, I think all of those lines show us that we don't. Plus, it really did make me nervous to have all those people so close together. It'd be much better if those people could be much more spaced out.
Well, these are urgent days for sure. Dr. Jha, thank you so much for your time. We appreciate it.